Mental health is defined by the Lancet Commission on Global Health and Sustainable Development as the capacity of one's thoughts, emotions, and behaviors to enable a person to realize their potential, to deal with the day-to-day stressors of life, and also to be a productive member within a community. It's important to invest in child and adolescent mental health because childhood and adolescence lay the foundation for good mental health in the adult period of life, as well as contributes to good outcomes, both for educational attainment and income, which are important for development in low and middle income countries. In addition to that, it's important because we know that cost-effective interventions do exist, and we can implement those into low resource settings, and that if we intervene at an early stage, actually the gains that we see are so large that they highly outweigh the upfront costs that you would put into it. The social determinants of mental health include poverty, insecure housing, education, social support, and experience of violence. We know that there's evidence that mental health problems or mental disorders are not evenly represented across genders. And a lot of this is, we know that women or young women are more likely to experience emotional disorders like depression and anxiety, and young men are in particular more vulnerable to substance misuse, alcohol misuse. Now, we can't say for certain that these are specifically directly linked to gender. What there are probably social and cultural contexts that really play a role in mediating these effects.
There are 6 key messages. The first and foremost is that child and adolescent mental health is a key opportunity to do more and to do better. That with just small changes to existing programs and strategies, we can make big impacts for child and adolescent mental health. The major approach needs to be through linked and layered intervention, and by linked meaning linking with existing health and education systems as well as social development systems. Layered meaning interventions need to be stepped prevention, promotion and treatment interventions. It's critical that people working in this field really know their target group, so that they have the formal research in place to be able to define this group and know the context in which they're living, and also to engage with those young people, to get them really truly involved in the intervention design, development and potentially implementation. The white elephant in the room is that there's a huge knowledge gap in child and adolescent mental health in low middle income country settings, and there's a real opportunity to do more by integrating evaluation and monitoring into existing programs to contribute data towards filling that knowledge gap. The final message is that one size definitely does not fit all within child and adolescent mental health, and it's critical to integrate really rigorous adaptation processes into the development and implementation of child and adolescent mental health interventions. And twinned with that, the identification of existing coping strategies within the target community, and an awareness of how they can be then integrated into the final intervention.
I think that donors can can really make a difference for mental health in a variety of ways. One is to really make sure that mental health as a cross-cutting issue really impacts more than the specific narrow focus of funding only for mental health. So if they can integrate that into existing funding for various things in development or sexual health, sexual and reproductive health, those things like that, they can make much more of a difference and also allow us to collect data on the social determinants that are related to mental health. Another way that donors can really have an impact on mental health is to include young people that are suffering from mental health problems or other sorts of psychosocial disability within their existing programs, and make sure that they have access, and inclusion is one of the key tenets of the work in which they're funding.